We want to bring in Dr. Anthony Fauci, of course, chief medical advisor to President Biden and the director of the National Institute of Allergy and Infectious Diseases at the NIH. Dr. Fauci, thanks for waking up with us on this Saturday morning. Let's get right into it. The new CDC guidelines. So many parents want their kids back in school. If they're already there, they want them there full time, but they also want to make sure that they're safe. Why is 3 feet okay for children, but not okay for adults?
Well, there've been a number of studies, one recently from Massachusetts, that showed if children wear masks consistently and you compare children that are at 3 feet versus children that are at 6 feet, there was no difference at all in the infection rate among them. And for that reason, as usual, based on the scientific data and evidence, the CDC has modified their recommendations. So now children, as long as they continue to wear masks, will be in school at 3 feet. That doesn't mean with the teachers, because they still have to be 6 feet from the teachers, and the teachers still need to be 6 feet from each other. But the children from each other, 3 feet is going to be okay from now on.
Obviously, a lot of offices, companies are paying close attention to that as well. Do you have any expectation that that could change things for adults, for the way businesses do their job going forward?
I think eventually that's going to be the case. What the CDC does is that they try to the best of their capability to accumulate good, solid scientific evidence and data, the way they did with children in school. When that data come in, I believe you can expect to see some changes in recommendations for a variety of things: workplace, travel, places of worship. Those are going to start rolling out.
Well, Dr. Fauci, we are making progress, as you know, distributing vaccine shots. But at the same time, cases are on the rise in 13 states all across the country. So I guess the question is, are people getting too comfortable?
I'm actually concerned that that is the case. If you look at the dynamics of the outbreak, we had that big surge in the winter, the midwinter, late winter. Then it started coming down really, really nicely until you reached around 50 to 60,000. And now it's plateaued, as shown on the scheme on your on the screen. That is not a good thing, because what's happened in the past and history has shown us that when you have that plateauing, that's usually the forerunner of another surge. We've actually seen that in the European Union. They're usually around 3 to 4 weeks ahead of us in the dynamics of their outbreak. They went up like us, came back down, plateaued, and they pulled back on their public health measures, masking and things like that. And right now they're going through the beginning of a surge, 5 or 10% increases. I'm really concerned if we declare victory prematurely that that's the same thing that's going to happen. Vaccines are coming on really well. Between 2 and 3 million doses per day are going into people. If we could just hang on a bit longer, the more people get vaccinated, the less likelihood that there is going to be a surge.
Yeah, well, Dr. Fauci, as you have explained, this is obviously a race against time, and we're dealing with new variants, as are those European countries that you mentioned. So how big of a threat are those variants right now?
Well, there are a number of variants, but the one that right now is gaining momentum in our own country is the B117, which is the UK variant, as they call it, because it just happened to be first noticed in the UK. The good news about that is that the vaccines that we are distributing now, the 3 vaccines, work very well against that variant. There are a couple of other variants that are more worrisome that have not actually become dominant and don't look like they're becoming dominant. So the one we're focusing on right now is the 117. There's one in New York, a 526, that's of concern. But hopefully, if we maintain our public health measures, that will not become a dominant variant. But you have to keep your eye on the variants. But as I mentioned, luckily for us, our vaccines work well against the 117.
Dr. Fauci, there's a new poll that got our interest here. It shows that roughly 18% of those healthcare workers in the country say they do not plan on getting vaccinated. These are the folks who have seen this COVID crisis firsthand. They've seen it at its worst right now. So what does that say about our chances of reaching herd immunity? And what is that threshold that we as a country have to reach to keep all of us safe?
You know, Peter, we don't know really what that number is. You can make an estimate of what it is. I've had mentioned a few times, and it's purely an estimate, somewhere between 70 and 85% of the population vaccinated. I mean, anytime there's a degree of vaccine hesitancy in whatever group, you just mentioned one, healthcare workers, it's disturbing. We have to continue to outreach to them and try and convince them, first of all, without being accusatory to them, to try and figure out what is it about this that you're concerned about. Is it because you feel things have gone too quickly? You can explain that that really is a reflection of the science that's gone on for decades before. So even though time-wise it looks like it's quick, the fact is there's been a lot of effort and science gone into it. And whether it's safe and effective, that's been proven pretty clearly that it is highly efficacious. So we've got to continue to reach out to those people.
Dr. Fauci, last question. Of course, this might be the toughest high school point guard captain of your team back in the day at Regis High, America's point guard, some have said right now. Your picks for March Madness, who's going to take it all?
Well, I have to be loyal to the locals, so I have to go with either UVA or the University of Maryland, even though the odds are not great for them, but I still want to go with them.
All right, the Terrapins and the Wahoos are grateful for your support this time around. It's nice to see you as always. Thanks for making time for us.
We're going to hold you to that prediction, Dr. Fauci. Thanks, Dr. Fauci.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.